Hi, everyone. Welcome. We'll get started in just a moment. We're going to give it just another minute, let folks come in. All right, welcome to the International Parking and Mobility Institute Shoptalk for hospital and healthcare parking and mobility professionals. I'm Kim Fernandez, IPMI's Director of Publications, and I'll be assisting George Richardson, CAP, with today's event. As a reminder, today's Shoptalk is being recorded and will be posted to IPMI's YouTube channel. As we get started, please introduce yourself in the chat box. Click the chat icon at the bottom of your screen and then type and click send. I'll be monitoring the chat box throughout today's Shoptalk, so please use it at any time to ask questions, raise points, or share your thoughts. If you have a webcam and are comfortable doing so, we'd ask you to please turn on your camera so we can all get to know each other a little bit and interact face to face. We're starting this event with all participants muted. When we get to the conversation part of today's program, please let us know in the chat that you'd like to speak. We'll call on you to please unmute yourself and jump in. Phone participants, press *6 to unmute your line. Before I turn things over to George, Dave Honorato, CAP, IPMI's chair, would like to say a few words. Dave?
Thanks, Kim, and good afternoon or good morning to those joining us from the West Coast. I would like to welcome everyone to today's Shoptalk, Parking and Mobility Challenges and Solutions Confronting Hospitals and Medical Centers. With today's uncertainty due to COVID lingering on, it is always good to hear how others in the industry are responding in their path to recovery. Before I turn it over to our host, I'd be remiss if I did not recognize IPMI staff for giving us the ability to stay connected, whether it's through our Shoptalk discussions, webinars, frontline training, in the forum, which is our online chat room. These are all gathering places to share information and to build relationships and keep people connected. I hope you'll be able to join us at IPMI in Tampa, Florida, November 29th. Even though this event may look a little different from the previous shows, I can guarantee you that we still have a lot planned for all attendees. Now, without further delay, it's my pleasure and honor to introduce today's host, George Richardson, CAP of UF Health Shands Hospital. George, it's all yours.
Thanks, Dave. I appreciate it. Thank you, Kim. Hello, everybody. Welcome. I want to start off by saying something, and I hate to speak for everybody, but I'm going to do it anyway, that COVID sucks. It really, really sucks. It sucked in 2020. It sucks in 2021. But we got to get through it and we got to get past it. So I'm hoping that some of the things, the challenges that we had due to COVID, and that's kind of what I'm focusing on, but there may be challenges that have nothing to do with COVID that we can address here so we can help everybody out. So my name is George Richardson. I'm the manager of Parking and Transportation Department at UF Health Shands Teaching Hospitals in Gainesville, Florida. We're a not-for-profit organization, and we share the campus with the University of Florida, Go Gators, down in Gainesville, Florida as well, of course. And they are a state entity, which they have the teeth to enforce our parking and transfer parking regulations. Where we differ is they are student and faculty and staff focused, where we as and the healthcare system is patients and visitor and our employees. We're focused on them. And it has been extremely challenging through these times. Our nurses and our staff, they're just depleted, they're exhausted. And I'm sure you're experiencing the same thing when you're in. So we want to talk about a couple of things that challenged us through the COVID on my end, and then I'm hoping that you guys can chime in and let us know what challenges that you had on there. Like Dave and Kim said, or excuse me, like Kim said, if you are wanting to chime in, please unmute yourself. Introduce yourself, where you're from, the name of your organization, what city you're from, and then let's have some discussions. Rachel, are you able to pop up the one? Okay, let me start. Are you going to control it too? All right, thank you.
I am catching up to you as usual. Hold on a second. We will get you all squared away.
So one of the things that happened during COVID is the students got sent home on campus. The students got sent home from campus and we had parking wide open. Because University of Florida controls the decal sales, they decided to waive the payroll deduct for our payroll system to allow people to not have to pay during the pandemic, which was, of course, a huge financial burden on our end, but I think it was a fair thing for us to do, and University of Florida as well. They opened up their side of the campus to kind of a free for all. You can park wherever you want to park. We couldn't do that on our side because we are very small in comparison to the University of Florida. So there would have been just an overwhelming abundance of people parking on our side over there, and we still had to have a little bit of control on our side. Other than that, we still stayed open. Our shuttle transportations, they continued running. We serviced, we just kept our shuttles clean. We didn't change anything, but I'm kind of curious to see if anybody else had those challenges. So we'll talk about that later. So the first thing I want to talk about on the challenges, if you'll hit the button. If you hit the next button, it'll, yes. So we, and I don't want to say the F word, the FREE word, we give complimentary parking to our patients and visitors, but we charge our employees. So I'm kind of curious, did anybody else have any charges or drop any charges or provide complimentary parking for their people who park there? Or do you not even charge anybody at all? I just don't know how the health care system works in your area. Anyone?
MD Anderson, at MD Anderson, we reduced parking 50% for all employees that were parking on there. And we did that for over a year, about a year and 4 months. So we just went back to full rate parking today. And patients continued to pay the full rate, whatever the day visitor rate was.
So you had daily rates and you didn't drop that, you continued that with you.
We did not drop that. Most of it is done through Texas Medical Center, not us, but even we have one garage, it's a patient garage, and we didn't drop it either. So they continued to pay the day rate. It was just mainly the employees that were coming every day that we adjusted for.
What was the feedback on that? What was the, I'm sure you had some kind of flack coming from still charging during the pandemic.
At all? Yeah, we had some employees that felt that we shouldn't charge at all, but you know, we just tried to explain to them, it's an auxiliary, it's still running. We still have to pay the bills, you know, and we still, you know, everything comes from the fees. So we had to, you know, dip into our fund balance to make it work. Like you said, I mean, it's a huge hit. And so, yeah, we had some people, but you try to explain it, and they were just happy to get it. They're more frustrated now that we went back to full rate because they look at it as we're, you know, this Delta variant, and they look at it, wait a minute, we're still in the middle of this. Why are you going back now? And it's like, look, this was decided a long time ago. We just can't keep going. I mean, this could be going on for years and hopefully not, but still got to get back to operations and run things. We did offer we have some reduced parking now, you know, if you're only going to be here 10 days or less, we've got a different rate now that we didn't have before. So we are trying to make some adjustments for those individuals that are hybrid, because we have a lot of people working from home. And we also have a visitor component now, those that don't really need a parking contract, but may come 1 or 2 days instead of having to have, cash in hand. We're setting up a way where they can just go into a garage and just get charged by their credit card. So we did have to adjust our, just the way we did business and offer different options with those that are the hybrid now. But that's what we did. At Anderson, I'm sorry, this is Diane with MD Anderson.
Thank you.
Sorry.
Anyone else?
Yeah, hi, this is Alan Peterson from Yukon Health. So yeah, hear what you're saying. It certainly has been a tough year and a half. So early on in the pandemic, we raised our gates in the patient areas and didn't, we stopped all transactions. Of course, not charging. We suspended valet service as well, but we kept the staff on board, to assist with wheelchairs and directions and those sort of things at the entranceways and in the driveways, and also use staff to do our best to keep the parking facilities and the entranceways as clean and disinfected as possible. We didn't make any changes to the employee parking structure per se. We did have quite a few people, administration, finance, et cetera, who were working remotely. And, on a rough number, about 50% of our staff pay for, I guess what you would call premium parking access. And then the other 50% have a free permit with, just not quite as convenient access as the paid permits. We didn't make any adjustments there. We did allow people, if they contacted us and said, I'm working remotely, I really don't want to pay for parking. So we would give them an opportunity to exchange their paid permit for a free permit, and then kind of keep them on the side outside of a wait list. And so that if they return to campus, they would have a first shot at getting back into paid parking. We have very few, out of about 7,000 people registered for permits and about 2,500 with paid permits. We have very few, a handful or less that decided to exchange their paid permit in, because we have a pretty modest rate in the big picture. So most people decided to keep it, and on the outside chance they had to come to campus for a meeting or a work day or something, so that they kept their parking. And so that was early on in the pandemic, March, April 2020. And then by the middle of July, as things started to improve here in Connecticut, we lowered the patient gates and went back to the fees there, and restarted the valet operations as well, with a lot of cleaning and disinfecting protocols in place, cleaning all the touch points and the keys. And of course, we've had a mask mandate on campus since the very beginning of the pandemic, and that continues today. So since July of 2020, we've been more or less, from July, I would say, through September, October, we were in what we called returning to normal operations, and kind of climbing back up that hill to where we were with other appointments and procedures outside of COVID. And now, for the past several months, we're basically at or exceeding our volumes of where we were, during the peak of during pre-pandemic levels. So we are very busy, between normal appointments, procedures, drive-through testing, and vaccination clinic. We are very, very busy on campus as far as the patient volume goes. And earlier, actually last month, about the middle of August, essentially all staff have returned to work on campus, except very, very select few who it made sense, for like a telecom operator or maybe a finance administrator to work at home several days a week. But essentially, everybody's back on campus. And from a parking perspective, we're pretty much back to normal, and some days exceeding where we were pre-pandemic.
Sure. No, I get it. I appreciate your input. I tried to convince them to let me work at home. They didn't buy it here. So it just didn't work. Anybody else?
Hi, George. This is Kyle. I manage the park and transportation at Mill Nest Hershey Medical Center, and that's in the sweetest place on earth. That's Hershey, Pennsylvania.
Yes, it
So
is.
everybody probably knows it from the wonderful world of Hershey Park. But yes, with the pandemic, and we don't charge for any of our parking for our patients or our employees. We do restrict employee access to certain lots and then have other lots open for patients. So for us, there really was a change in the reduction of our visitors that were coming. We still had patients coming for major services, but a lot of surgical services went to the wayside. So there was really an overall reduction in patients coming in, and restriction to only those patients coming and not having visitors for them while they were in the hospital. So really just regarding charge versus complimentary, there really wasn't a big change for us. A lot of it was more pivoting of services. Because we did have to shut down our valet service for about 3 months there between March and June. And I pivoted our shuttle service to provide transportation for a lot of our elderly and disabled patients that were using the valet service to be able to park close by and get into the main entrance. So those are the main things I had as a challenge to begin with.
Very good. Thank you, sir. We have anybody else want to comment? So I'm interested to know, and it's hard for me to do it in this setting, but how did you come to, and this is for everybody, how did you come to a decision on how you're going to change what you did? Did you speak with other colleagues? Did someone else in the parking world and transportation world help you out? Is this something that your leadership decided? It's just, we just don't have enough time to talk about it now, but or maybe we do it towards the end. I'm just kind of curious with that. So, but what I hear is there's a few people talked about valet already. If you can, Rachel, if you can go to the next one, please. That is actually part of what I said. Those who do have valet, we continued our valet services. We had them doing the same cleaning that we did inside the hospital, outside the hospital. We focused primarily on our disabled community with that because they get free valet parking through if they have a disabled placard that's registered. I'm just kind of curious, if you shut it down, how was that impacted? Because we have a contract valet. So we had to tell them that they're going to take a financial hit just like everybody else is. Or did you continue valet services, and what protocols did you take to make sure that they cleaned the inside of the vehicles just like we do our hospitals? Open to anybody.
Hi, I'm Flora Solomon. I'm within the Anderson Cancer Center. We closed our valet operation. We were parking probably 1,200 cars a day right before COVID. We closed our valet down at the end of March, and we pivoted with the valet staff, and they became our screeners. We kind of had an addendum with our contractor, and they helped us staff all the entrances to the hospital and help with issuing masks and taking temperature and checking the monitors. We reopened valet earlier this month. Initially, as we were working on the reopening plan, on the cleaning aspect, certainly we have our internal protocols, but I took some pointers from Texas Health and Human Services. They had some checklists out on specifically what needed to be done in terms of cleaning. That all since has disappeared from the website, but we ran some of it by our infection control as well. So we had a kind of a good basis of what to do since we had been closed the whole time. So we have hourly cleanings of all the workstations. We purchased an electrostatic sprayer We have been doing that with our shuttles. So we bought one for the valet. They can spray the key room. They can spray the vans that we have, because we transport the drivers back and forth to the storage area in vans. The first couple of weeks, we didn't need it. We have some available parking nearby, and we were able to store the vehicles close to where we didn't need it, but we grew out of that within 3 weeks. We're still at only about 37-38% of our prior volume, but that still required us to go to a storage area that was further away. So we're spraying the vans with the electrostatic sprayer, the restrooms and the key rooms, and then everything else is being cleaned on the hour. Everybody has to wear a mask. So it's a combination of both, but that's kind of the protocols that we've been following since we opened, and we have not had any issues.
Sure, thank you. And that's an excellent way to repurpose the valet company to help you out with that. We scrambled around a few times and they did borrow some of the valet because it was a reduced staff. So excellent way to repurpose the valet and keep them employed as well. Anyone else?
So George, I kind of touched on it when I talked last time about us shutting down our valet service. So we did retain some valet employees to work during the day to provide direction and assistance as we pivoted that shuttle service. What I also had them do was retain, because we parked somewhere on the tune of about 600 cars a day pre-pandemic. I had them maintain tracking how many vehicles were coming in that they were sending to the valet lots that were coming up, so that I had a real good indicator as to when the volumes are returning. When we started to come back out of the pandemic, the initial surge released in June, and that we had to restart valet. And at that point, I really partnered up with our infection prevention team as far as what, protocol that they had in the hospital for sanitizing. And then also working with our vendors, since they had started to look at that as well, and their valet services that they maintained during the pandemic for what they had recommended that they were going to do. And partnering up with both, basically our contractor and my internal staff, we came with a really good protocol that we've maintained and has provided a lot of protection for our patients and also our employees working within the vehicle. So they're really sanitizing hands, the outside handle, the inside handle, the shifter, the steering wheel, and the turn signal in the car, and pretty much leaving everything else. And again, doing this without gloves, because that kind of sets you up to have a false sense of protection without a glove, whereas utilizing an open hand and doing it with a regular sanitizing wipe, and then sanitizing with hand sanitizer between vehicles work to be the best method to accomplish that for the team.
Excellent, thank you. Anyone else? And Kyle, I might have missed on the first, when you talked about the first time, it sounds like you had the people who wanted the valet to self-park in valet. That was so what you did?
Correct, yeah, they were self-parking. We were directing them to the lots we normally use for valet. And like I said, pivoting our shuttle services at the time that we maintained our regular shuttle services. Those that were running off campus shut down because we weren't able to travel that far with someone in an enclosed environment that wasn't allowed. We have a run that goes up to the main college, up in State College, the main university. That shut down and got shuttered during the pandemic. Is just coming back now after the holiday, that we'll be running back up to the main campus. But we utilize those staff to be able to provide that service at the initial time of the pandemic.
Perfect, thank you. And I remember one of the biggest challenges for us is we wanted to keep everything clean, but we couldn't find the products to clean anything because it was all out. We just couldn't find it anywhere. So we were struggling with that for a while. And it's so crazy to hear you talk about you're just now coming back online, because we've been back for a while. I didn't even realize that people were still out doing, because
yeah, we still have quite a few people that are remote working from home that can still do that, and those are typically a lot of support service individuals, administrative individuals that can do that work from home. But we do have a conduit, because the medical center and our College of Medicine for the university are all on one campus. So we really have a mix of both students, staff, physicians, faculty, patients, visitors, and employees that we, compensate and make sure that we're taking care of them. But we have the other contingent of people that would travel for research and other purposes back and forth from main campus to the College of Medicine in Hershey.
Thank you, sir. Anyone else want to comment on the valet and not the valet? Okay, I'm gonna take a second. Kim, you have a polling question. Can we do one of the polling questions now, please?
Absolutely. All right. Have you seen any revenue recovery since March 2020? If so, what percentage? We'll give this a few minutes. All right, we'll give this another few seconds. And there you go. There are your results on the screen.
Wow. I mean, it's coming up though, at least, that's a positive. It's coming up and we need this. I honestly don't even know what my revenue, we got it back pretty quickly after probably about 6 months of being down. But it was a rough time. We did not have to, and at least in my department, the parking transportation department, we did not have to reduce staff. We did not have to cut hours. We were fortunate enough in that. And they did take away our raises. We're a little spoiled down here. They actually give us raises every year. For you state people, I'm sorry, but they do for us. And it's like we cut their legs off. You couldn't believe it. We're not getting raises. I'm like, be happy you got a job. There are people around the country who don't even have jobs. You don't understand what people are going through because you guys are spoiled silly. Thank you very much for that, Kim.
Sure.
Rachel, could you do the next slide, please? Do any of you, we have a shared parking garage that is unmanned, and we monitor it through with a license plate recognition system. It is a horror show to try to monitor it 100% because we have employees who care a little bit more about themselves than they do the patients that we have here. So they want to park at the most convenient time. Oh, and when it rains, you can forget about it. So I just want to know if anybody's having any problems with shared parking. Are you gated? You're doing fine with it? Do you not have gates? Are you maybe using the LPR system, license plate recognition system, to monitor it? Any thoughts or comments on shared parking? And when I say shared parking, we're sharing it with patients and visitors. We have a retail area. Valet uses some of the floors, and then we have a gated premier parking area in that section as well. With I think it's a 700 space parking garage.
This is Frank Castro with Children's Health down in Texas. So we have a parking garage that's both patients and some employees, as well as valet. It's an 800 space garage. And we just started implementing a new park system, and we're using LPR to help us manage it. We do have some of our employees, again, that decide they want to take the prime parking. But we also recently installed a guidance system in there that helps us track license plates. So we can see where any of our employees who have registered in our parking system are parking, and we can monitor where they're parking so that we can ask them to please make sure they're parking on the 3rd floor and above. So that's how we manage that system, and it seems to work out pretty decently for us. And we've just done that recently within the past 2 years.
My problem is not everybody has to register the vehicle. And I've been trying to fight for that everybody on campus should register the vehicle. And I've tried to sell it on a safety issue, et cetera, especially in today's world. Leadership is kind of listening to me. Most of the time they ignore me, and there's a reason for that. Rachel knows my personality. So there's a reason people ignore me. But that is the problem that I'm having on my end, is that not everybody registers, and there's only a certain amount of people that have to have a decal, because after 4:30, you can park almost wherever you want without a decal.
Yeah, that in the beginning, that was one of our biggest issue is whose vehicle is where, and especially when you have that shared garage, if you can't identify who's parking where, then of course you've got our patients and families that are coming in that are having to park a little bit further or whatever, or in some instances it was getting to the point where the garage was getting full all the time by 10 a.m. So we were having to see who was coming into the garage and what they were doing. So at that point, it was a decision made by our senior leadership that we were going to require all of our employees to register in the parking system, especially because parking was free to them.
I'll keep this recording, Rachel. I'm going to send it to my leadership so they can hear that. I appreciate that, Frank. Anybody else? People, if I don't have any participation, Kim has ordered me to take a piece of clothing off.
Hey, George, it's
you
Alan
go.
Peterson.
There you
Sorry.
go.
Alan Peterson again. I'll just kind of piggyback on your concern there. We share that concern here, and I think that many campuses have that to some degree. So I'm curious to hear how, and I'm sorry, I didn't catch your name, with Children's down in Texas, but curious to hear your experience with implementing the LPR in the garage, and if that is used only for permitting purposes, or is that also associated with transient, with patient parking for their fees as well? So are you going ticketless, just LPR, and are you going virtual permit as well?
So at the moment, it was we're just in that implementation stage for permit. So we're still working on the whole park system and LPR currently. So right now we're using it as permit with the intent to use it for our transients, so they can be ticketless. But we're still going to have the tickets for those that require it, as well as we are going to be using it to assist us in our voucher system for some of our outpatient clinics that provide complimentary parking. We've set it up so that the clinics have access, limited access to the system, and where they can make appointments for some of these patients and folks that are coming in. They can get their license plate at the time they put it into the system, and we know who's created the voucher and how long the voucher is for, so that folks that are coming in, we're just scanning in and parking and finding a spot, and then as the LPR is getting them out. So that's the feature we're going to be hopefully rolling out here in January.
Oh, that's great. Great. Thank you for that. And maybe we can connect offline. Really interested in that sort of thing. We're actually just kicked off a software upgrade for our permitting and enforcement, and we'll be looking in the coming years to update our parks system as well. So it's always great to hear about people's experiences in the real world, as opposed to and nothing personal to anybody on the call, but as opposed to what you hear from the sales world. Those real world experiences are always helpful.
Yeah, it'd be great to talk to anyone. Just feel free to reach out to me and share my experiences. I mean, we've gone through a major rehaul on our parking because of where we're located. Parking kind of a premium as far as what we had. So we wanted to use the parking that we had more efficiently versus building more parking. So we've spent close to $3 million, I think, in between the new park system and a new guided system in there to help enhance that customer experience. And we call it streamlining and making it a frictionless experience for our patients and visitors that are coming in, as well as our employees.
Thank you, Frank, and thank you, Mr. Peterson. Anyone else have any shared parking experiences? Okay, so Mr. Peterson, just to let you know, we use our LPR for virtual decals in one of our parking areas, and it's working phenomenal. We could use our LPR for enforcement to actually go ticketless. We just don't have we're not a state entity, so we can't enforce any of the parking rules and regulations. And the University of Florida uses a different system that we do. So we're just not playing together right now. But it does have that capability. So if you'll get my information later on, you can contact me as well. No one else
Great.
has.
Thank you.
Yeah, no problem. No one else has shared parking that there's no way. There's got to be.
I do, Rich, or Georgia, I do.
Sure.
It kind of goes along with what Frank said. We do share a garage. It's about a 1,100 space garage. It is shared for patients, employees, and valet. It is not a gated facility, and basically our security officers, they're not sworn on. They're not sworn, so we're not a police force. So we don't have the ability to enforce moving violations, but within the state, we're allowed to enforce our own parking violations thanks to agreement with the township.
Sure.
So we do have that issue where we have people that will park on first and second level, which we denote to be visitor parking. We do cite them with a heavy fine. They do have the ability to appeal a fine and give their reason for it. And then that goes to committee for a decision on the appeal. But we have that same issue where, it's a case where we do require all of our employees that work on the campus and the immediate surrounding area in Hershey to register their vehicle, to affix a permit to their car, and that we do use that to identify them. The challenge that we've dealt with is when someone is from the immediate area that doesn't put the permit on the car, or even someone that works there decides not to put the permit on the car. So we have come to the point of where we are going to transition our database of information and how we retain that parking information over and tie it into our enforcement software, which is a separate entity from our database that we use. Our database is tied in more with access control, and we're going to look at possibly LPR for enforcement, but I'm very encouraged that, and it sounds like it's a fixed LPR that Frank's using to come in the garage to get an idea of who's going in, where, and where they end up at. So I'm really encouraged to have more discussions regarding his experience with that and where we stand. So yes, it's challenged in a shared parking environment to get people to where they belong, and it's a constant communication piece that has to go out there, and especially during the pandemic, there were multiple communications reminding people not to park in patient spaces, even though it seemed like there were a lot less patients there.
Sure.
During the pandemic.
I think one of the biggest things, if you can get your leadership behind you, that's the most important thing. That's where you start. If you can get leadership behind you and support you, then you don't have as hard a battle to fight. Anybody else with shared parking? Thank you for that, Cal. Rachel, can you go to the next one, please? Shuttling employees. Now, I've got some feedback from most of you about how you shuttled your employees, and I think the next one might be shuttling visitors and patient committees to do it all at once. Yeah. It sounds like most of you either adjusted your shuttling or don't have shuttle service at all. Did anybody totally stop shuttling employees and only concentrate on patient and visitors? Is there any feedback or flack from doing that? Other than who I've spoken to already, would you please chime in? Do you have any more stories on how you had to shuttle or adjust your shuttling of patients and visitors, and how keeping the buses clean during the pandemic?
This is Clarissa with MD Anderson again. I oversee the shuttle contract. The employee shuttles ceased operation at the end of March of last year, and we restarted them in a different way The old routes didn't come back. They don't serve the purpose. You know, there's a lot of us working from home, and we're trying to keep areas separated. So we had, 4 routes, 3 buses on each route, by request service. So we stopped all that for the employees, and there was parking that was, they could sign up for a monthly contract in a facility that was closer to their work areas. So they were given that option. Our campus is very spread out, and you can't really walk from one end to the other. So the employees had that option just to get a parking contract in a closer spot. We reopened shuttles for employees in July, redesigned a new route for the new needs of the institution. So we have separated the research buildings into one and the administrative buildings into another. We use the electrostatic sprayers, and we take them offline every 2 hours to clean all the high touch areas. The patient shuttle did not stop at all. We have one route with 2 buses that services just the patients, and that's been in operation the whole time.
And separation, did you have to adjust for separation, maybe give more shuttles because you were keeping them apart inside the shuttle?
No, we have the seating is limited on both shuttles, but the volume went down to where we have not had to add, even though there is reduced seating inside the shuttles. And we've always separated the patients from the employees.
Got it. And I can imagine in July walking on the campus of Texas, it's a little hot. You're going to be a little moist when you get back to the place. So hope you jacked up the price of the closer park.
One thing about MD Anderson as well is they're committed to keep at least 30% of their workforce at home. So it is definitely a different way of doing business. They have no intention of everybody coming back on campus. So the shuttles didn't necessarily, they don't serve as many people right now. And we're still trying to figure out what that number really is. We're still kind of in the balance of who's staying home for sure and who's coming back and who's doing the hybrid. But Anderson is committed to a hybrid and work from home. If you don't need to be on campus, there's no need to be on campus type philosophy.
If I don't know if you're contracted shuttle drivers, but did you have to reduce staff, or is it contract?
Yes.
Both
Quite
of them.
a few drivers were furloughed.
Got it. Okay. Anybody else with some shuttle issues?
Okay, so
Solutions.
in the pre-op area, there's the 8 days, it's 3 pre-op and 5.
All right, I'm taking my shoes off. We're starting. We're starting.
All right, George, I'll help you out. So
Thank you, Cal.
we maintained our all of our shuttle services, and really we run shuttles on a very similar route throughout the campus, but we do mark one for patients because it hits more patient points of entry and exit from our mega structure. And it does travel, to more patients would be collecting or have to be picked up to come in to the hospital. For our employees and our patients, we did reduce down by a matter of about 50% on the capacity and socially distanced inside the shuttle. We did not do any kind of separation from the driver to the passengers. But we did institute, again, a cleaning protocol that we followed on all of the vehicles. And that one for our fixed routes that we run, which was our employees and for patients. Those fixed routes were doing a cleaning, had to at least do a cleaning every 2 hours whenever they were in service. And we run it for about 12 hours a day. So they were stopping 6 times a day and doing the cleaning protocol. We do an on-call or on-demand service as well. That's how we serve the community around the hospital. And for any of our buildings that don't have a fixed route service to them. So that particular shuttle service that we have, really, we did lose a lot of ridership off campus. So it did help support the on-campus movement. But we did do a more aggressive cleaning protocol in there, since they are more of a minivan sized vehicle traveling, 1 to 3 people. And then we're in close proximity to the driver compared to that. So normally in those we run about 6 people. So we pared it down to 3 at the max during the beginning of the pandemic. We still have our social distancing protocols in. We have had a mask mandate on campus since the beginning of the pandemic. That has not changed, even though the Commonwealth has changed their masking requirements for the general public. Anytime that anybody is in our buildings or in any of our equipment, our vehicles driving around, they have to be masked.
Very good. We would, as a requirement on ours, we'd actually keep extra masks on board to hand out to people who forget them, or and we just refused if they wouldn't get they didn't put the mask on through service, which never happened.
Correct. Yeah, we have had the same situation when the Commonwealth pulled the masking requirement, that we had patients especially that would come and get on the shuttle bus. So since that point of the Commonwealth pulling that, we have maintained a stock of masks to provide for our patients. Or if an employee, typically employees aren't already masked coming out of the buildings and getting on transportation, not an issue there, but definitely for our patients we have.
Thank you, sir. Kim, can we do another polling question?
Absolutely. All right, those who use LPR technology for any form of parking services, what is your return on investment? We have less than a year, 1 to 2 years, 2 to 5 years, 5 to 10 years, or more than 10 years. And we will give this just a moment for those of you who are using LPR to chime in. I'll give this another second. Right. You can see the results on your screen. I'm going to read them just for those on the phone. We have 40% said 1 to 2 years, 40% said 5 to 10 years, and 20% said less than a year.
Very good. That's not a bad ROI. Ours is a little bit longer because we don't get some of the University of Florida gets all the ticketing money that we do on our end, but they also have to deal with the appeals and the complaints and the screaming. So I'm perfectly fine with giving up that money for it. So that is all I have for the challenges. What I want to do is go to the next screen and then so were the challenges that we're experiencing any different? I'm sure they are during COVID, or were these challenges there before and COVID just made it more challenging? I'm just kind of curious to what challenges you guys had. And this is also a time I want to open up. Are there any other challenges that you want to talk about that we didn't talk about that you might want help with, or recommendations or anything? I think you guys are good. Sweet.
This is Frank again with Children's. I think I mentioned this before and I was speaking in regards to others, but one of the challenges, the biggest challenge I had about 4 years ago was just how do we use the existing parking more efficiently? And I think before COVID hit, we were putting a lot of transportation and demand management initiative play to try to use our existing parking more efficiently. We were talking with Lyft and Uber about their programs of bringing in patients to our facilities so that they don't have to miss it or worry about parking. We were talking about rideshare programs with Waze for our employees so they could feel comfortable, sharing a vehicle with other folks that were coming to the hospital, their employees. They may not be in the same department, but at least they knew they were a children's employee. So we were looking at all these different ways, and we knew we had to do something with our parking, and we were trying to figure out what that best option was at the time. So we had all these things in play and what we want to do. made a game plan and we started moving forward, and then COVID hit. And one of our initiatives was to offer flexible schedules to some of our administrative employees, those that didn't have to be at the hospital. So through COVID or whatever, that kind of took place. And now that we're like some of the other hospitals where if an employee doesn't have to be there, they work remotely. So we've got that working for us. We took advantage of the case that we weren't having as many patients come onto campus. At the hospital at one time was only allowing one parent to come in at a time. So we didn't have as many visitors coming in and so forth. We took advantage of that at the garages being down. We were down about 40% occupancy. We went ahead and started implementing our new park system, our new guidance system, and of course the new LPR system with the not having to adjust and move many people around, which was going to become a big challenge for us at the time. If you have a garage that's 89% utilized, how do you move people out, or how do you move people around in order to put these systems in? This kind of just naturally took that burden off of us, and we were able to get all this stuff and implement it and put it in. So in a sense, we took advantage of the situation.
Yeah. So did the construction people. They did all sorts of work. The
Oh, yeah.
streets were empty. It was crazy.
Oh yeah, they were eager. They were so eager to get in there and get
Sure.
going and do the work and stuff. So yeah, it really helped us out tremendously. I would just say that.
Perfect. Thank you, sir. Anyone else? I know before COVID, I got yelled at every day about parking. Where can I find any parking? There's no parking on campus, or we can't park anywhere. I got to park way out and catch an RTS bus to get to campus. Now there's available parking, and the complaints are, well, I don't have parking right beside my building. Why don't you spit on the ground and build a garage and have parking right beside my office? So it's changed in that dynamic, where we still have people complain about they're just never happy with parking. And of course, I'm the parking guy. Nothing else? What changes did your entity make for you to get back mentally and physically? I know we had some mental guidance, and I apologize for calling those. I just don't know what your name is right now. It's our EAP department to help you out, because there was so much stress, so much depression going through the hospital that they needed help. What steps did you guys take to kind of get on track physically and mentally, or are we not there yet?
George, I don't have an answer, obviously. I don't have to do the job that you guys are tasked with. And that's what I was thinking after 18 months of this. Your doctors, your nurses, your teams, your employees, your staff. First of all, God bless every one of them for getting it done. But you know what I mean? How are you supporting them? Especially when we're hearing about labor shortages, not being able to find shuttle drivers, not being able to find the people. It's one thing when you can't find a server at a restaurant. It's another thing when you can't find an essential person at hospital.
Sure.
So I'm curious, and especially as IPMI, how can we help you find additional staff? How can we, support you as we hopefully move forward to a full recovery?
Well, the thing is, no matter how many times you advertise a job, people aren't looking for jobs out there. Some of them are just completely happy staying at home and not working and using the money that the government gave them, or however they're getting money. So people who are qualified for it aren't even applying. Our school system down here are short of school bus drivers, and the kids. My kids are all grown. There's kids who are waiting for hours and hours to get home. I would go nuts if that was happening to me right now. So I don't know. I don't know how that. I can tell you how I cope. Is that I usually keep a large bottle of vanilla Crown in key locations throughout my journey home, and that's how I cope with it. Please delete that from the recording, Rachel, because I am still Mr. Leadership, but that's how I cope. Anyone?
This is Diane with MD Anderson again. One thing that Anderson has done is they've really taken a look at what the their salaries and what they're offering employees. So I think in January, we are going to a $15 minimum wage for MD Anderson. So our hope is that some of those shortages that we're having, maybe that will help at least entice people to come work for Anderson versus somewhere else. But it's quite a jump. We jumped to 13 in some specific positions, and then they just went straight to 15 across the board in January coming. So trying just to entice people to want to work there.
Sure. Our hospital did something similar. There were certain levels that they brought up because the minimum wage raised, and those guys needed that. And of course, the people above that, what about us? It's incredible. We just want to shake certain people. But that has to help. Everything's going up in cost anyway, so anything helps in that part. So that's great that your company is doing that for you. Anyone else?
I think we have time for one or two more comments, George.
Yeah, somebody. I'm gonna call on somebody. I'm just gonna pick somebody random just to say hello so I can hear someone else's voice. Melinda, I can't say your last name, so you're out of the, you're lucky. Marakovich, just say hello to me, please.
Hi there, it's
Hey.
Marakovich.
How you doing?
I love the way that you're coping with COVID. I am similarly doing something like that.
All the crown.
Yeah.
We got to hang out at IPI. IPMI, excuse me.
Yeah, that sounds like a good plan.
Thank you so much. I know we're out of time, so it was actually a very good meeting. I thank you all very much. Thank you, Kim. Thank you, Rachel, for hanging there and putting up with me and helping me out. Dave, thank you for introducing me. I love your voice. I'm a Philadelphia Eagles fan. I know you're in Pittsburgh, but at least it's the same city. I mean, same
We
state.
won't hold that against you.
I know you won't hold it against me. Rachel's, you got to be a Philly fan. You're up in Philly. Never mind. I can tell by your face. You're going to say something nice.
I'm a nice Philly fan. That's I'm a casual observer of
Okay.
things towards Philadelphia.
Not a problem. Listen, thank you very much for the opportunity. The last slide had my information
I'm
on there.
sorry.
It's okay. If she can pop that up there, you can write down my information if you have any questions that you didn't feel comfortable asking in front of people. We're managers, I'm sure I wouldn't, but that's my information. That's my direct line to my office and my email address. You can feel free to email me, call me. And I have garage counters as well. I can share my experience with that. I have license plate recognition system. I can share whatever experiences I have with that. And anything else parking related. I do want to pick some of your brains on some things as well. So please feel free to contact me. Thank everybody very much for attending and try to have a wonderful, wonderful day.
Thank you, George, so much for moderating this Shop Talk. It's really been great. And thank you to all of you for participating with us today. We'd love for you to continue the conversation and connect with George and connect with your colleagues at our online community. It's at forum.parking-mobility.org. It is part of your membership, very easy to use. We would love to see you there. Our next Shop Talk will be held on November 3rd, and it'll include a panel discussion on diversity, equity, inclusion, and the future. I hope you'll mark your calendar, and I'd love to see you then. We also hope to see you at the IPMI Parking and Mobility Conference and Expo, November 29th to December 3rd in Tampa, Florida. Registration and hotel block reservations are open now, and there are details on our website. Thank you again for being with us today. This concludes our Shop Talk. You may now disconnect.